And welcome to another edition of The Doctor Is In. I'm Jim Callow, your host, and today our guest is Dr. Juan Bauza, who is a member of the Aurora Bay Area Medical Center group and is practicing his cardiology knowledge at Bay Area Medical Center. Dr. Bauza is board certified in internal medicine and cardiovascular disease and received his training at the University of Puerto Rico of Medicine Medical Science Campus in San Juan, Puerto Rico. His residency and fellowship took place at the Veteran Administration Hospital and the VA Medical Center in San Juan, and he was the chief of cardiology at BAMC Medical Regional Hospital in Puerto Rico and chief of medicine at the Midlands Hospital in Nebraska. He's practiced in a number of locations, including Nebraska and with the U.S. Air Force, and joined BAMC with over 20 years of experience in the field of cardiology. And welcome to the program, Dr. Bauza.
Thank you.
All right, let's talk about coronary artery disease. That's the topic for today. And first, let's define what it is.
Okay. Coronary artery disease is basically build up a cholesterol plaque in the blood vessels that feeds the muscle of the heart. So we call that coronary artery disease. And it implies, since it's the blood vessels that feed the muscle, if you have problems with the blood supply, you're going to have problems with your muscle.
And you're going to have problems with your heart.
Yes.
All right. Let's talk about some of the warning signs of that heart attack.
Okay. In general, the patient will present with chest discomfort. Rarely is pain, described as pain. It's mainly a chest discomfort. It's a pressure that occurs behind the sternum on the left pectoral area. It can go to the arm, to the jaw, or even to the epigastric. It is reproducible on activity, usually. It can occur at rest, but it's mainly when you start doing any activity that it occurs. It starts very insidious, and with time, as the blood vessel gets occluded, your exercise capacity starts going down. It may be associated with shortness of breath. It may be associated with palpitation. But when the heart attack occurs, the pain is serious, and some people describe it as a feeling of impending doom that they get when they have. It may occur with cold sweats, shortness of breath, palpitations, and even syncope, passing out. In females, there's a population that has some atypical features to those. There's some of them that may feel like it's a jaw pain only without any other problems, and they may think it's a tooth that is causing the trouble. And we have seen patients being referred from the dentist to us because of the they have no caries and they're complaining, and the dentist has been smart enough to recognize it may be the heart and send it to us. Others present like it's a gallbladder problem, and they go to the ER, they get evaluated, gallbladder is normal. Somebody gets a light on, do an EKG, and then we get the referral. So, but basically, those are the main manifestation of the heart attack. That's the classical manifestation.
All right. So you're saying that prior to the heart attack, it's more of a discomfort than a pain.
Mm-hmm.
All right. But you got to pay attention to that discomfort,
yes.
Don't you? All right. Bay Area Medical Center is starting a cardiovascular interventional suite. Tell us about that.
We have been already doing cardiac catheterizations and stenting there for several years now with good success. It became obvious that the population here were not always willing to go down to Green Bay or even to Chicago or other areas to get it evaluated for the heart. And once we had the resources here, so we decided to go and open the heart cath suite, and we are able to do not only cardiovascular procedures, we can do also peripheral vascular procedure in the arteries of the legs as well. We obviously, it's a limited facility. We don't have surgical backup, so we do not do very high-risk cases. We just do try to keep it simple as much as possible. If the case needs something more sophisticated, then we'll refer them to Green Bay or other areas.
All right. So let's talk about some of the procedures you do at your suite. Now, you mentioned the cardiac catheterization.
Mm-hmm. Cardiac catheterization is just a procedure that we go in through the wrist. It's done under twilight sedation. It's not general anesthesia. We use local anesthesia around the wrist for the puncture of the artery. And then we go in, and with the catheter, we image the blood vessels of the heart. We look how the blood flow goes there and where the blockages are. If the blockage is present and it's a simple, non-complex blockage, we might be able to open it up by putting a balloon inside the artery and expanding the balloon that will crack the plaque open the blood vessel. And because it's a tissue, it will recoil after the balloon is expanded. So we put a stent there, which is another thing that a wire mesh, a cylindrical wire mesh, that we leave inside the blood vessels so it doesn't recoil. We can do also measures the pressures inside the right heart or the left side of the heart. We can assess the vessels of the legs. We can do the same procedures in the legs and resume blood flow to the blood vessels of the leg and the limb. We may spare amputation for that limb. We do not do acute cases like acute heart attack because those are more complex cases, and those we treat and refer to Green Bay for more sophisticated intervention.
So do the patients that you see, normally would they come in through the emergency room or do they get referred from their doctors?
We see from both sides. If it's referred from the ER, we usually take care of them in the hospital, and then we decide where is the best option for the patient, either cath in the hospital or we can transfer them to Green Bay. We also accept referrals from outpatient, from other doctors in the area, and we see them in the office and we'll treat them as they deserve to be treated.
Okay. So when somebody comes into the ER with what appears to be a heart attack, you're going to get called.
Yes.
Yes. So you make the determination which way to go.
Exactly.
All right. Let's talk about some of the risk factors for coronary artery disease.
Okay. So the main risk factor of coronary artery disease is you have the smoking, you have the diabetes, hypertension, high cholesterol, age, being a male, sedentary life. Those are the classical main ones. All of them, except for the age and the sex, can be treated. The genes, usually, if it's not a matter of reversing your familial inheritance for developing coronary artery disease, but we can manage whatever risk factors you are inheriting that causes the coronary artery disease in you, with medications or lifestyle modifications like for diabetes or high cholesterol or the smoking cessation.
So you mentioned the genetics, and that's kind of why when you're going in, they'll ask you if somebody else in the family has had coronary disease.
Yes.
And that is a risk factor.
Yes.
All right. So lifestyle changes to to make it less likely that we'll get coronary artery disease?
Well, one
Quit
of them
smoking, right?
is quit smoking. That's the first one. For the heart, one cigarette is the same as 10 cigarettes. One will do the same damage. So it's not that I have been trying to quit smoking and I only smoke half a pack, and before I was smoking a whole pack. The damage is being done is the same. So it's quit smoking, the first one. Second, be active. Don't become a couch potato. There's a lot of people that get retired, and then what they do is they go to the couch and watch TV, and the only exercise they do is with the thumb changing the channels. And that by itself will promote occlusion of the blood vessels. So be active is another one. Watch what you eat. I mean, if you eat a high-fat, high-cholesterol diet, that is going to go somewhere. And one of the places that it goes is to your coronary arteries. So you're going to get blocked. The coronary artery disease is a disease that is very slow in onset. But once it explodes, it does it in a big way. It's the heart attack, it's the sudden death, it's the heart failure. And that's a bad way to die or to live with, is that you are drowning in your own blood. That's heart failure. And it's a very, very bad way to do. There are people who say, well, the best way to die is if when I sleep and have a heart attack and I die. Well, that's a very selfish way of looking to the life, because if you're not giving your family or your other persons that you love and the time to mourn you or to be prepared for your loss, you're just gone. So that's a kind of selfish way, the way I look at it. So don't do that. I'm sure your wife is gonna, or your husband is gonna tell you, no, that's not the way to go. So it's preventable. That's the best thing about coronary artery disease. We can prevent this process. There are people who argue that it's preventable 100% of the time. Not everybody agrees with that, but it's very preventable disease. Just manage your risk factors. And walk, don't smoke, and take your medication for your blood pressure, take your medication for your diabetes, take medication for your cholesterol, watch what you eat. That's it.
Never too late to start.
Never is too late to start.
All right. Well, those I think are the things that we've heard over and over again, and they're true. It's what works. So, if someone wants to get a hold of you and get some more information on their particular cases, how do they find you?
Sure. You can go to the web and www.bamc.org, or call us to our office, 715-735-8067.
All right. So Cardiologist is as close as Bay Area Medical Center. All right. Our guest today has been Dr. Juan Bauza, who is a cardiologist at Bay Area Medical Center, and we thank him for being with us today as we find out a little bit about coronary artery disease.
Thank you.
That's our Doctors In program for today. Join us next time. The Doctor Is In is brought to you by Bay Area Medical Center.